Hi, smart moms and dads. Welcome to another episode of the Brainy Moms podcast, brought to you today by Learning RX Brain Training Centers. I'm Dr. Amy Moore here with Sandy Zamalis, and Sandy and I are excited to bring you a conversation with our guest, Dr. Randy James. Dr. James is a board-certified family medicine physician and an Institute for Functional Medicine certified practitioner. His medical practice focuses on finding the root cause of illness, along with methods for prevention and healing. And he specializes in assessing each patient's unique biochemistry, their genetics, and the social context of their health and wellness. And we're going to talk to him today a little bit about what functional medicine is, why we should care, but we also want to talk to him a little bit about the field of epigenetics and how our environment and lifestyles interact with our genes to cause risk and illness. Specifically, we do have questions about testing for genetic variances related to ADHD and autism and other mental health diagnoses and chronic illnesses. We are going to touch on MTHFR, which is one of those genes that we see all over social media these days. And fun fact, Dr. James is my physician. So I am super excited that we're going to have a conversation with someone who walks the chronic illness journey with me. So let's welcome Dr. Randy James.
Thank you, Amy and Sandy. Glad to be here.
All right. So let's start off with your story. How did you become a functional medicine physician?
So my dad is a doc. He's an MD. He's an otolaryngologist. And I like to quote him. At one point in my teens, he said, he didn't say this, but this was the effect of, I was his worst patient ever. And I got all the stuff. I got the ear tubes and the tonsils and the allergy shots and the everything, but I was still, and so I will quote him here. He said, why is my son always so symptomatic, but not really sick? And so I didn't have a diagnosis and I could do all of the whatever I was doing, but there was always the head and neck symptoms. So that was the 80s, and it was definitely not cool to do anything alternative back then. But that's where he started thinking and then experimenting on me, so to speak. So from 15 to 25, I got well-er, mostly through lifestyle changes. And by that point, I'm already headed towards regular medical school, but with an eye towards a different approach. It wasn't called functional back then, right? Like it was called integrative or holistic or whatever. Or it wasn't really called anything. So the 90s was kind of what I would say was the birth of functional medicine. That's where that term started to becoming in. I graduated medical school in 98. I was in the military. I got told very quickly, stop all that weirdo stuff and just color within the lines. So for 10 years in the military, and that was fine with me because we were overseas and newly married and traveling a lot. Coming out of the military then in 2007, and now I've started my family. So the second flavor of what was leading towards functional medicine was kid number 1 and kid number 3 had some significant issues. And I didn't want to start them off on medicines, medicines first, questions later. So I remember coming home one day and I told my wife, well, we had done some extra labs, sort of outside the box labs. And I'm like, holy cow, like we've got to figure this thing out. That was a Saturday. And the next day was, I think, Father's Day, and it was ice cream day at church. So here we go. Day number 1 of declaring war on my son's metabolism. And you can't have ice cream. And it's like, well, how do we do this? Well, you got to draw a line. And so, screaming kid in church, can't have ice cream. And that began, those 10 years of helping my own kids, helping myself, and trying to figure it out. And then that led to me saying, well, gosh, how do I help patients? Because we had transitioned from the military into normal sort of insurance-based American medicine. And then several iterations later of how do you run a business trying to do that? And then here we are. So that's kind of my very high level, 50,000 foot view of what led to what we're doing now with functional medicine.
So talk a little bit for our listeners who don't necessarily know what functional medicine is. Talk a little bit about what that means and why we should listen.
Oh yeah. Right? Like, is it right or wrong? Is this true? And that's, of course, and I would describe it as that's an infinite question, because at the end of the day, no, you're not going to figure out a human being. There's always going to be mystery. There's always going to be pathology. Nobody's perfect. But in contrast to a typical American medical system where the system is built very well if the problem is acute trauma or acute infection. So if you get in a car wreck, call 911, right? We got good stuff for that. But when the problems or the puzzle becomes more, how do I feel? What is energy? And so then the question, I would go to the patient and say, well, you tell me how you want to function. What are your goals? Because functional medicine, and this is where I would have a beef with most functional medicine doctors, there is no such thing as optimal. There's no such thing as optimizing hormones, and there's no perfect human out there. So what does optimal even mean? So through my lens, the word function is, well, how did God design us to be? What does that even mean? So we quickly get into theology and philosophy and a person's own perception of their own, whatever they deem to be dysfunctional. So that's what I would say is the main essence of functional medicine. But then you get into, well, it's a systems-based biological approach. Everything is related to everything. Every human is infinitely biochemically unique. So those are kind of the textbook answers. But I think it makes more sense for people if they're asking the question or they're thinking, I don't feel quite right. Then I would ask, okay, describe that. So that sounds like dysfunction. Well, what is function? Tell me about your fatigue without using the word energy. Like even Einstein could not define energy, so don't use that word. And then we quickly get into somebody's life, like whatever the thing is impacting their marriage or their family or their effort or their perceived effort at work or their success at work or grades or those things. So that's what I would call function.
So talk a little bit about what that means for parents, right? So like at what point would a parent say, okay, this traditional approach to fixing what's broken is not fixing what's broken, right? There's something else happening here. And so how would they know it's time to look towards a functional medicine through a functional medicine lens instead?
So when we approach it through that lens, my answer tends to be built around classically perceived pathologies, right? What's broke? So I'm going to answer that question, but I'm going to begin with, gosh, in a perfect world, if there is a functional type of doc or let's say parents that are thinking this way, then it begins, pre-pregnancy, right? Like, and it begins with gestation. Like, how are you taking care of mom in order to take care of baby? And then once that baby is born, and, nowadays, certainly the world has flopped back over to, yes, breastfeeding is the best way. Well, when I will ask people, whether they're 10 or, 50, were you breastfed? And the answer is always yes. And then I say, how long? Oh, a month or 2 years. Like, well, like if breastfeeding is only a month, then I wouldn't call that breastfed, and there's going to be a consequence. And maybe that consequence is now we're into that pathological kind of, well, as a parent, what might we be seeing in young ones? And so, and I'll go back a step further. Was this a C-section baby or was this a vaginal delivery? Because that makes a difference. And C-section babies are at higher risk. That doesn't mean they're going to die when they're 2. It just means they're at higher risk to maybe be, for their physiology to respond in a dysfunctional way to normal challenges of life. So So then in that infancy phase to the parents, I'd say, well, are we, as an infant meaning 0 to 1, I would look for, is there any kind of, colic being a famous one? Well, that's not normal. And the babies don't just grow out of it. Like, that's a really terrible thing to say to a mom that can't sleep. And now you've got a mad kid 24/7. Something is going on there. And I wouldn't just chalk it up to normal, or that's this kid, or they're going to grow out of it. In the infancy, so 0 to 1, I would also be very mindful of skin. Like, yes, we'll be tolerant of some cradle cap and some milia, but that, that might be a little signal that something's going on. Another one that when we're doing that, like the famous chappy, rosy cheeks, you just look at a kid and they look cherubic or cherubic, whatever that was. They look like a cherub.
Yeah.
We don't say that word anymore, but that's not nice, right? Like, they should not look like that. That's an inflammatory response to something. And yet it just, when I walk around, I see people, and at a restaurant, I see those things. I learned a long time ago not to approach a mom and tell them that. They don't always tell that.
Excuse me, I'm a doctor, and I just want to let you know that your child's rosy cheeks are not normal.
So, moms have to have an ear to hear, right? Like, they got to be open to something like that. And then we go to the toddler phase. So 2, 3, 4, it's not normal to have ear infections. Children aren't built with a deficiency of the pink stuff. So how often, what's going on? Are they in daycare? Those kinds of exposures, there's nothing right or wrong or good or bad. We just think through those things. And toddler, if there's constipation, if the child's not sleeping, if there has been ear infections or multiple ear infections, those are kind of the clues that I'd say, let's think more broadly about this. And then we go to the elementary years. So in the elementary years, now, we've got whatever it is these days, 1 out of 60 kids with autism or whatever. So we ask those questions. And if we're seeing that early, we do want to ask. So today is not a vaccine question, but we ask the question of, well, are vaccines there? And what was the timing and all of that? And has there been a personality change in the elementary years? Are they sleeping? Do they wake up rested, or is this kid hard to wake up? Are they mouth breathing? Do they snore? Snoring is never normal. Mouth breathing is never. These are pathologies. All humans are on the spectrum. All humans are neurodiverse. So we give infinite mystery to the variability there. But if mom says, no, this kid, something is different, and now they're more this way, that's a big red flag. Like, let's be aggressive down that pathway looking for, and then it depends on what they're talking about, the kind of labs or procedures or a brain map or whatever that we want to do. But in the elementary years, that's when we really ask the brain questions: ADD, ADHD, OCD. How's the sleep? What's the sleep pattern? Mommy, my tummy hurts. Is that a theme? Congestion and irritability. Maybe they have the allergic faces or the puffy eyes. Oral. If they're snaggletooth, or if teeth don't have, or if the dentist says there's not enough room on the oral side of things, that's when we start to really look aggressively at the oral window. What is the mouth telling us? If there's already caries or cavities in those early phases, it's not because they're on bubble yum or mom doesn't know how to brush their kids' teeth or whatever. It's likely, what are they eating? And they're probably mouth breathing. And then into the adolescent, pre-adolescent, and now we've got all these neuroendocrine disruptors out there. We've got women starting their menstrual cycles at 9. Like, those kind of questions are important to understand what's the pathway of the function that this body is on, and can we mitigate? Can we nudge it one way or the other? So that's a biggie, is asking young women, when did the menstrual cycle start? And of course, and I'll ask you guys, if I ask a teenager these days, or a woman that's cycling, what's the percentage of women, teenage women these days, women these days, that have irregular cycles, cramping, PMS, or other sort of body symptoms, breast tenderness or acne or something related to their cycle? what percentage of women say yes?
100?
Yeah, most.
That's
Right?
like a
It's
trick
the
question.
weirdos that don't have interesting metabolism. Um, no, and so who is the first person that gives them their first medicine? Their mom. And they're highly educated, highly caring. Oh, I just want my kid to make it to school today, and whatever, we got to do something. And I get it, but you're not born with a deficiency of Motrin. And then Motrin becomes Midol, and then Midol these days, and I don't know what the percentage is, half, close to women in high school on birth control. And my wife, who works at a pregnancy center, gets so frustrated because these women don't know why they're on birth control. They have not had that kind of a conversation with their doc. Moms don't even know why. It's just, well, take a pill and you'll be better. So yes, there is going to be, a woman should know she's on her cycle. There's going to be an awareness of those kind of things, but it ought not be painful. It ought not be disruptive to life with, it's so heavy, you got to stay home or whatever. It ought not change your personality. Like that's not normal to have PMS. That is abnormal. If we look at just a common sense evaluation of the data of women over the past recorded human history, yes, there's menstrual cycles, but we in modern America, we've normalized the pathology. And I feel so badly for young women today. And of course, it's going to breed anxiety. And of course, it's going to have an impact on your brain and how you approach, the complexities of teenagerism is complex enough. And then you throw this in there and it just becomes a problem. So you can tell, we see a lot of people that are on that side of the hormone complexity. And of course, the younger and youngerness aspect of that is a little bit of a mystery. I mean, if you go back to 1850, what was the average age of starting your menstrual cycle? It was like 15. And now it's 11 or 12. So something is changing, and it's multifactorial, and we can debate forever about what's going on there, but something. And so I just want parents to have the awareness that what their culture tells them is normal is not wellness. It is normal. Like averagely, people are overweight and depressed and anxious and all that stuff, but let's not normalize it. Let's give people the opportunity to know that you can think differently about that. And it's not being a health nut or a weirdo. I would say it's what medicine ought to be.
Okay. So what I'm hearing you say then is that maybe one of the reasons why we hear so many doctors saying, well, let's wait and see, is because as a culture and a society, we have normalized pathology because it's so ubiquitous.
Yes. Which makes sense, right? Like the fish doesn't see the water that it's swimming in. Right? The old joke of the man asking the fish, how's the water? And the fish says, what water? Like they don't know anything otherwise. And I would say that's true of most, especially if we're on the woman's side, most women who are adults and now grandmothers have also experienced this. It is normal. But it ought not be that way. My hope is that it ought not be that way. There is a better way. Again, we can't moralize it, and I don't want people to perceive shame or wrongness in that way, but more opportunity that it's not irrational to want to be abnormal in that you're trying to be well. But the tide of our culture or the flow of that river is so strong. And to be quite honest with you, I would say the most difficult patient we have is female, 16 to 18. because in order to change the physiology of her abnormal metabolism, the social coin is way too expensive.
I'm sorry. I thought you were going to say the most difficult patient we have is 54 years old and her name is Dr. Amy.
Well, I should have asked you, is there anything off limits?
Right. No, there's nothing off limits. We're very honest about our struggles with our listeners. So they know all about our challenges. Okay. So one quick clarification, and then I want to move into something more specific. So what I'm hearing you say is that periods are not supposed to be painful.
I don't think so not all women have a painful menstrual cycle. And I would say my wife is one. And so here again, the fish doesn't see the water. So she didn't know that all the other women were having all of these things. And at one point, she was kind of surprised, not offended, but I can't tell when she was on or off or whatever. So she was like, well, you should be able to tell. And I'm like, well, it's a good thing that I can't. And right, like, because for most women would have the experience that they can tell and probably their family can tell. And I don't think that that has been the norm for all women over all time until the modern culture, modern society, our exposure to the amount of insulin, glucose, cortisol, the neuroendocrine disruptor question, et cetera, has had such an impact, a generational impact now, that in order to push that flow back the other way to where averagely women would have not painful periods, I don't know that we can ever get there.
Were you
Right?
shocked
Like
by that, Sandy?
I'm one of those people that doesn't. So for me, I know other people struggle with this issue. I'm not one. I have my own other litany of things I struggle with. But for that particular issue, no. I think what I keep thinking while I'm listening to you, Dr. James, is that it's so hard to find people that think like you, that really want to get down to the root of the issue. Because even if, these things come up, like in my family, we struggle with autoimmune issues. My daughter specifically, juvenile rheumatoid arthritis. And that was a really hard challenge to find a physician who would help us get to the gut piece of that equation. There was a lot of medications and things to try to calm things down. And, I love that you're saying that it's a nuanced issue, and you have to look at it from as many sides as possible and not just think about it from put a Band-Aid on it or smack a medication on top of it, but really think about the sleep and, what's happening and all these other pieces, but to not feel guilt about it. Cause I've had people say that before. It's like, oh, this is just another way to mom shame, right? Like blame it all on the mom that it happened in gestation or whatever, or they didn't breastfeed or all those things. But it's not about that. It's about just understanding how we're created and how things are naturally supposed to be, so that we can better manifest that.
So I resonate with you so strongly because my third son is also on the autoimmune spectrum. And so I can dad shame myself a whole lot. In our family, and the initial thing you said there is, it's hard to find somebody, and that is the most. If I'm speaking somewhere that's not my community, then the most common question is, well, how do I find a doctor that thinks that way? And I know that is the sort of the linchpin or the bottleneck, and so we're trying to change it. Right? Like, and there is more of a grassroots kind of awareness. You've got Google now. There's ways to spread that. But along with Google, in my awareness, comes a lot of confusion, because now there's infinite things you can do, and somebody always wants to sell you something. So we have felt that too, with a kid that's got pathology, and then I'll wake up one day and I'll feel the feeling of, okay, I gotta fix this. Well, now that kid is 14, and he has his own opinions on anything that I would suggest. And they're usually opinions that are opposite of mine. So now we're in that, the navigation of not only my sense of maybe failure at not helping him as much as I coulda, shoulda, woulda, and his own sense of, so my son has alopecia, so totalis, like everything. And well, for us to think about going to middle school in the 80s with alopecia, like I think it was more traumatic then, and probably more traumatic for a girl. These days, though, he's kind of the cool kid and different and unique. And so near as I can tell, he's not perceiving devastation. But still, how do we help our kids without shaming ourselves, without shaming our kids, especially in those middle teen years? There's no pill for that, and there's no right diet for that. There is no magic sleep powder for that. It is what you're saying, hopefully finding a partner in the medical community that can walk with you down that pathway, and they are just very hard to find.
Figure out what works for you, right? Because what you're saying too is, we're all biologically diverse, right? Like we're all, what works for one person may not work for another, because it depends on what's causing like the inflammation, or what your genetic markers are, what your blood type
Very
is.
true.
So many factors.
It's just infinite,
All right. I love that you said that, because I think that's a great segue, Sandy, into really what we want to talk about today. I want you to talk a little bit about how epigenetics plays this huge role in functional medicine and what that is, why it matters. And then I want to talk about MTHFR as a genetic variation on a theme, and what that means for us, and should we care?
Yeah, I do enjoy talking about genetics, and I hate it because well, let's start at the 50,000-foot view, like what, the genome and what it is and all of that. And so here, a good analogy is that, we cracked the code, so to speak, of the human genome in 2000, 2001, whatever it was. So we are 25 years later. That's, in the science world, that's an eternity. How many genetic drugs are out there? How many major breakthroughs have there been? Barely any. Why is that? So it's like one day when my son at, age 4 or 5 said, "Hey, Dad, I know how a car works." I'm like, "Oh, how's it work?" And he's like, "You push that pedal down there with your foot and it goes." And he's totally true. And I'm like, "Oh, let me show you something." And I take him around, I pop the hood and I show him the engine. He's like, "Yeah, whatever. You push this pedal. That's what makes the car go." And he's completely correct. So we popped the hood on the human genome and we said, whoa, no idea how this stuff works. Like this, they thought they were going to see the code for diabetes, the code for cancer, the code for whatever. But the reality is that all humans can get diabetes. All humans can get cancer. So all it did was create more, not confusion, but complexity. So here we are 25 years later. And then you've got guys like Ben, whatever his name was, that did the MTHFR stuff. And so then we kind of have flopped over to maybe an overreading of, oh, well, I'm MTHFR, so therefore my depression or my whatever symptom is, well, I'm MTHFR. I'm like, well, okay, that's not totally true. That's not. And so to help people think about it, I am going to use a genetic reality that we're all familiar with called, what is the tone of your skin? I don't want to offend you guys, but as far as I can tell, you are Caucasian females.
That would be correct.
Okay.
I thought I was going to get a rosy cheek analysis.
We look terrific today. I do a little bit.
I'm going to ask you what you've been eating. Um, so the tone of your skin is a genetic predestination. It doesn't matter what you eat, doesn't matter whatever. But as a Caucasian person, by definition, you have an increased risk of skin cancer. So there's a medical true statement based on averages. Compared to average brown, you are at more risk, right? Fair? But have you ever walked around saying, oh, I am pre-skin cancer. I'm going to get cancer. I am Caucasian. Therefore, I have to think about skin cancer every day, all the time. And what most people will do is they'll say, you know what? I'm going to wear a hat. I'm going to put on some sunscreen. I'm going to wear some clothes. I'm going to create a habit, a lifestyle that is appropriate to the genes that I now understand have an impact on my future well-being in my life. And we would call that wisdom. Okay. What about MTHFR? And what about epigenetics? So epi means above. So it's kind of like what is surrounding the genome. And technically it's about, well, how does the twisted up ladder of the gene, how does it fold in on itself and unfold and all of that? But people don't want to walk around thinking about that. They can think about, well, what am I bathing my genes in? What kind of food, what kind of sleep, what kind of environment? Do I love my job or hate my job? All of those things, that is the epi. And then these days, we now have these subsets because we do have enough knowledge to say, well, this MTHFR thing and how people methylate and what methylation is seems to be related to some of the things that we care about. So we check everybody. I think that ought to be a version of primary care. And the two that I think we have enough data on would be MTHFR and the APOE. And then there's probably another 20 that we could argue, maybe we should know the COMT or the, whatever. And then you've got the genetic hobbyist, and I would call it they want to know everything. But at the end of a discussion of genome, my frustration. So in 2019, before COVID, we did everybody's almost full genome. So that's a cost. And the problem is you can't interpret. Or if you try to interpret, you're going to wind up with a lot of bottles of supplements. And that's it. That drove me insane. It just became this conduit to buy these supplements. And they called it precision nutrition. That's not nutrition. That's supplementation to nutrition. And so that felt very frustrating to me. It felt very expensive to the patients. And at the end of the day, you go through one of those things and it says, oh, you need more quercetin or PQQ or these weird whatevers. But people don't take their PQQ and say, wow, I'm more kind and gentle, I think. My wife thinks I'm a better husband. The things that you care about are so distantly related that it did not seem like it was functional to do a practice that way, at least through my lens. So these two with methylation and APOE, I think they are related enough to the things that you do every day that we can kind of say, okay, here's, if you're this kind of genetic variant or that variant, it's not, we don't say the word mutation anymore. It's a variance, and we don't say good or bad any more than Caucasian skin is good or bad or whatever. Caucasian skin would be a deep challenge if you're born in the Sahara. But if you're born in Norway, you probably don't think twice about it. Like you don't even wear sunscreen. So the same thing, if you are MTHFR, whatever variant, and you are going to live like an average American, you're probably inviting some complications down the road. The epi part of that, if you don't, well, so to be simplistic about it, what we tend to say is, well, let's go one step. So methylation is a subset of the biochemistry of detoxification. So that big, we could say, which is a subset of this thing called metabolism. And metabolism is what your body does to just not die. Every day you got to breathe. You got to drink some water. You got to eat some food. You got to sleep. This is all metabolism. Underneath metabolism would be the biochemistry of detoxification, which I hate that word because it really doesn't mean anything. Every breath you take is toxins, and you got to breathe out. And if you stop that, you'll be dead at about 3-4 minutes. But in between breath in and breath out is a few billion molecules of detoxifying and oxygenation and all that. And so a subset of that is methylation. And there's hydroxylation and sulfation and all that. Nobody talks about those because we don't have a real nice, neat, genetic whatever, because there's lots of genes. Even with MTHFR, it's, 30 genes. It's not just the main 2 that people talk about. So there's that complexity to remember. So we're in the realm of detox, and then underneath detox is methylation. And we have undermethylators and overmethylators, and you are genetically predisposed, not predestined, but predisposed to do detoxification a little bit more efficiently or a little bit less efficiently. Well, you can imagine if somebody is less efficient, problems tend to happen. I am one of those variants, not quite as unique as Amy, but still, I'm on the spectrum of more variable. And I didn't learn this until 50, right? Like we didn't know these things. And so then I see the red flags and in me, there was the hyperaldosteronism. So that's a consequence of that inefficiency, but you don't feel it. Well, some of me when I was 10 and my frustrations that my dad was saying, well, why is this kid symptomatic? By definition had to be related to that because I was born with a need to be epi or environmented, not in the typical American way, but in a different way. My mama loved me, but she fed me Fruit Loops. And then we got healthy and it was Cheerios. And for 30 more years, the missing piece for most people down that methylation pathway is this crazy supplement. Everybody hates taking it. I'm so sorry, but it's called green vegetable. So we don't live in a culture that highlights that. In even families that do pretty good, I say, well, what if we compared you to the little boy in Okinawa or somewhere else? And we don't know. Like, if I had been exposed to more spinach when I was 2, would I have less of a consequence at 50? That's where the science ends. So methylation, it's about 40% of people to a varying degree of whatever the variants are. And then if you're way over there, then we'd say, well, then, yeah, learn how to create the environment, eat the kind of things that enhance methylation as opposed to unenhance. And we have supplements that we can use, and we have markers that we can look at to help you know, are you on a better track or are you off track? And so that's the idea of increasing the chances of better function according to the person, infusing that with the science that we know, and infusing that also with the genetics that you now know about yourself. So is that a good overview?
Yeah, absolutely. So let's talk about the association between MTHFR variants and some mental health diagnoses. And do you believe that that information is power? Do we want to know? Does it help you explain to a parent? Well, first of all, let me back up. So if you read recent meta-analyses, so collections of multiple studies that have been done, there is a statistically significant association between MTHFR 677 and ADHD, autism, schizophrenia, bipolar disorder, and major depression. Did I say major depression? Anyway, that's one of them. Okay. So let's say that you have one of those diagnoses. Is it helpful to know that that could be a possible contributor? Or do we care? And would you do anything differently?
Well, no, I agree that it is very helpful to know. Very well, very enough to spend the money to buy the data and to have the data. Yes. And of course, do you go through 23, well, whatever other genetic thing is out there, buy it on your own and that kind of thing. If you run it through Quest and LabCorp, your cost is about $85 per. And of course you can spend thousands on that. For MTHFR, I like what you just said. There is evidence that suggests that if you have these variants, you are at more risk for these things, and especially the manifestation of what I just said about methylation and detox as it now impacts your brain and that brain-body connection. Yes, I agree that that is a piece of the puzzle of why we see more of those things today in younger people. Not that, I mean, the genetics haven't changed, but our environment has changed. And so back again to, and I know I'm being oversimplistic by saying vegetables or whatever, but infinite complexity of B complex vitamins and methylation and all of the interplay of whatever that is. And that's where I'd go to a mom or go to myself and in the nicest, non-shamingest way possible, say, you can't expect that the infinite complexity of a 4-year-old brain is going to be helped by Doritos or by whatever, right? Like, and nor are we out to become Pharisees about, Nazis and you have to eat this kind of food. But right, we don't have to go to a mom these days and say, oh, you should really think about SPF 30 on that fair-skinned child. I mean, it makes common sense. I think it should make common sense that Doritos and Fruit Loops and Cheerios ought not be on the table, but we live in a culture where the flow of that is so strong, and we live in a culture where the awareness of the spectrum disorders is so it feels so medical, and it feels so out of my control, and it feels so bad luck, and it feels so all of these kind of things. And we need the government to come in and make it free. And we need to get resources in there. And yes, okay, we can debate about that forever too. But I would say, well, what you can do is be aware of methylation, genetics, and those kind of things. And if you're a 677 homozygous, then that parent then knows, well, yeah, this kid, the Doritos are bad, but in this kid is really, really bad. And just knowing that, I do think it helps. Like some people say, oh, I don't want to know that because then it freaks me out and that bad things are going to happen. And I'd say, well, does it freak you out that you're a Caucasian? Like it's just, or, that it's just data that you can respond to give yourself a better chance to be as well or as functional as you want to be.
Okay, so I love that. And I'll even share that. So one of our kids is homozygous 677. And so and I am too, but we made the conscious decision that we were going to only eat organic foods because we did not want to have to worry about whether or not those pesticides were going to hang around in our bodies because we had that decreased ability to methylate or detox those, right? And so it was a decision that I was able to make that I would not have made because it is a little bit more expensive, not a lot, a little bit more expensive to eat all organic, but I probably wouldn't have even thought of that. 15
That's a
years.
great example. And even there, where the complexity of here we are 15 years later, and your son is what they are. They're not perfect. They could be better. They could be worse. And you actually don't get to know how much of a positive impact was 15 years of organic versus not. You will never know. And that here is not right, that right word. because people always say, well, how do I know if it's going to make a difference or not? I'm like, you don't know if you're going to die in a car wreck tomorrow. Like, you don't get to know what the future holds. But does that mean you should only eat Doritos because you might die in a car wreck tomorrow? Like, of course not.
Right.
So down that pathway, that's a great example. And even if somebody is financially challenged, I'd say, well, there's the clean 15 and the dirty dozen. Like, there are things that you can do that increase your sense of captaincy and agency in your own life and in the life of your kids. If you don't do them or think about them, then by definition, you're placing your hope in an insurance company, in big pharma, in the government, or somebody else that's going to take care of whatever the issue is. And again, if you get in a car wreck, the system works really well, but it does not work well when it comes to the spectrum disorders and all of these things that are becoming the major well, there already are major issues in our culture.
Yeah. And I think that, right, we don't know if we're going to get in a car accident or not, but every time we get in a car, we take that risk. And so we mitigate that risk by wearing a
Wear a
seatbelt.
seatbelt.
Right.
Yeah.
And so if we've identified a risk, like being homozygous MTHFR, why would we not want to mitigate that risk? Even though we don't have a pre-post metric, for everything that we do to mitigate risks, why would we not, as parents, want that for our children and for ourselves?
That's right. So our age group, like, you remember when you were going off to college, you didn't wear a seatbelt. I did, right? Like, and somehow we did change the flow of society, and now you feel absolutely naked if you don't have the seatbelt on. Like, and our kids, they actually obey, right? Like teenagers, they put their seatbelt on. I remember back in the 80s saying, I'm never going to wear a seatbelt and whatever. And I just, like, how does that happen? So I have a sense of hope in our society that, in smoking is another example of, well, it went from super common to not. And it's these kinds of things and the work that you guys are doing to increase the awareness. And I love that word, the captaincy, the agency, that you are the one that's most in control of your own wellness destiny. And again, without shaming, without blaming, without all of that. But if you don't take responsibility, you are giving it away to the government or to somebody and hoping for the best. Yeah. And I always joke and I say, look, Medicare doesn't care. Right? Like, yeah, at least they don't care about what you care about. You care about your function and your child's function according to your scale of what success and function is, not what Blue Cross says it ought to be, or your boss or your mom or, culture. That shift, and I think I really think we're coming into it, that there is more grassroots awareness of these things, and using MTHFR as kind of one point of departure for here's a way to think broadly about those things in a way that it increased Mom Amy's sense of confidence in the future well-being of her son. And that's a good thing.
Sure. So can you talk just briefly about some of those things that, like pesticides, that we might want to minimize exposure to if we have a child with an MTHFR variant that is a higher risk?
Yeah.
Like smoking and pesticides.
Well,
lead and
all of them. And I'm one of them. And so again, this has been a thinking process. I also have a family, and they're not me. And you have to navigate all of these things, and nobody has infinite money and infinite resources and infinite time. So for me, the threading of that needle, and so our family, and the general recommendation, right? Like, if we don't go to specifics for specific people with specific things, and we say generally, Like, and that's where I stumble. Like, I think all people over all time should minimize their smoking and their Doritos and glyphosate and everything, right? Like that. Now we're into politics and why can Germany outlaw this stuff and why are we doing it? And I don't know. So now we're talking to unique individuals who are making their own shopping choices. And so, yes, to the best. Well, first I would say eat your vegetables. And when it comes to vegetables, I would say on that clean 15 and dirty dozen or whatever, but lean as organic as you possibly can. And that then becomes like we have, and you and I have talked about this, but half of my plate is always green. Like that was a thing that I could do to say, yep, yes, organic, get the glyphosate off. Thankfully, I didn't have to worry about smoking and some of the other biggies. I live in Colorado. I live at 8,000 feet. We don't have a lot of pollution. So there's that. In my world, I don't have to trouble myself with, I don't buy an air filter like some people. Like if you live in a city, I'd have a air filter and those kind of things. I filter the water. Which one? We'll debate forever about all of that stuff. But we finally landed on one. We do lean organic and glyphosate, I think is a big deal and it's a big problem and you can test for it.
In your Cheerios, right?
And we don't eat Cheerios. And I challenged the person the other day, I said, because they were not aware of this. I was like, you need to walk down that middle aisle of the grocery store on the bright, colorful, interesting, aimed at children aisle and look at what is the front of the box of Cheerios brag about. It is emblazoned. Yes, with the American Heart Association's stamp of approval. That's criminal. That's just criminal. And it's Cheerios, and that's one of the healthy ones, right? So we live in this confusing world, and somebody that's listening to this is overwhelmed. Like, oh my gosh, the overwhelming feeling of, I've got to change everything and whatever. And I'd say, well, maybe start with step number one. Might be for me, it was Cheerios. You remember Denver. So Denver was an old partner and smoking, drinking, hard charging, military guy, heart attack at 36. All right. And he told the story many times. And the first healthiest thing he did was he switched from a 12-pack of Pepsi a day to a 12-pack of Gatorade. Not a great move. That was step number one. And it took, decades of refinement and engagement and all of that. So your standard can't be perfection. The heavy metal question, lead, mercury, those kind of things. And so that's where, down the meat pathway, I would say our mantra is eat happy animals. A happy cow is a cow that only eats grass. Leave it alone. Let it be a cow. Happy chickens only eat whatever chickens eat, mostly bugs, but not soy and gluten products, or molasses, sugar and corn, which is what we finish those things with. And we live in this industrialized world. So to simplify it, if you eat happy animals, and so wild caught, grass fed, grass finished, all those kind of things, cost goes up a little bit. Sure. Manage that the best you can. That I think is the best way because, the organic question when it comes to meats is a little bit more complex. I think there's probably more value on the grass fed, grass finished because the cow's system actually, pulls off some of that glyphosate if it's not completely organic. So there's a purification or a processing there. So
unless the cow has MTHFR 677 double,
yeah, that's right.
Double variant, right?
Now, I think that's a super interesting question if we go to Colorado State up here and say, hey, what's the impact on cows over the last 50 years? But I just don't think that, their big money source is still big government, big pharma, big whatever. So they're not asking those questions. So it's left to brainy moms to help other brainy moms who ask those brainy questions, not with an eye towards perfection, but with, we always say, improve. You can become a little bit better on your own standards of function. Yes, we have science, we have doctors, we have whatever that's going to help us to think through those things. And yes, if I need surgery, I don't want to be awake. I want to trust the system to do those things. But after that surgery, or in order to prevent that surgery, it is metabolism. There's just no way to get around it. It is your diet. It is the epi. It is your sleep. It's your relationship with your spouse. It's your relationship with your work. It's all of those things is what is going into either better function or dysfunction. And you, or we people, we get to be the main influencers in our own well-being.
Love that.
Can't change your skin tone. You don't get to become, a different color of skin. You don't get to change your MTHFR, but you get to determine how you nurture those genes.
Love it. So, Dr. James, we know you have a super busy practice that you need to get back to, but we would love it if you would come back, have a part 2 to this conversation, or even a part 3. Once you go, we're going to talk about you and then commentate on this really interesting information.
Thank you. And I'm happy to. I think this is important and we should be talking more about it. So thank you guys for the work that you're doing out there. And for the people that listen to you and are impacted by that, there is hope for we Americans. There is hope. All right. So I'm just going to exit myself here. Thank you guys for having me on.
Thanks for being with us,
Dr. James.
All right.
Okay.
Bye-bye.
Are you concerned about your child's reading or spelling performance? Are you worried your child's reading curriculum isn't thorough enough? At LearningRx, we recognize that most learning struggles aren't the result of poor curriculum or instruction. Instead, learning struggles are typically caused by having cognitive skills that need to be strengthened. Skills like auditory processing, visual processing, memory, and processing speed. LearningRx one-on-one brain training programs are designed to target and strengthen the skills that we rely on for reading, spelling, writing, and learning. With experience training more than 125,000 children and adults already, we'd like to help you get your child on the path to a brighter and more confident future too. Give LearningRx a call at 866-BRAIN-01 or visit learningrx.com. That's learningrx.com. There's so much information there. I just needed to absorb it all in.
Yeah, I think I was doing the same thing. Of course, these are conversations that, he and I have had previously too, because I am homozygous 677 on the MTHFR SNP. So these are things that I have been working on and concerned about, since about 2013, 14, when we had our genome run. We did the entire one for the whole family. And it's funny, I was looking at some email traffic that I had with Dr. James from 2017 after he had taken my genome and run it through like an external interpretation program and sent me the big 37-page report. And I typed back, "Oh my gosh, I'm going to die a slow, painful death." Right? Like, you're at risk for this and this and this and this. And, he quickly wrote back and said, number one, you're being dramatic. And number two, you have to interpret this more broadly than that, right? Like, yes, here are where your genetic variations land, but that isn't a prescription for death, right? That's, hey, let's identify where you can mitigate certain risks and know that just because you have that genetic predisposition doesn't mean that switch is going to get flipped, right? So I think that's the important thing to say is like, once we've identified, okay, you have a double variant in the MTHFR gene, that does not mean that you don't have any ability to detox, right? It means that that whole epigenetic component that he was talking about means the more burden you put on your body, the harder it is then for that gene to function, right? So if you don't put the burden on your body, then it isn't necessarily going to carry the same risk that if you overburden it with pesticides, lead-based paint, unfiltered water, air pollution, drugs and alcohol abuse, like all of the things. And so I guess I could back up just a little bit because we didn't even identify what MTHR stood for.
No, I was going to say, for someone who's listening who has never heard of
Yeah.
that particular gene marker, we probably need to just say what it is.
So MTHFR stands for methylene tetrahydrofolate enzyme. So it is the enzyme that's responsible for the production of, or the processing of L-methylfolate. So you've heard of folic acid, right? Which is a synthetic version of folate. So L-methylfolate is a methylated version, right? An already broken down version, I think is the easiest way to say, but that is responsible for this entire system of being able to help your DNA function properly. And so methylation is responsible for detox. It's responsible for production and metabolism of a few of our neurotransmitters, including serotonin and dopamine, which is probably why MTHFR is associated with some of those mental health diagnoses, right? Because we know that serotonin and dopamine are important and implicated in ADHD and autism, depression.
We'll have to ask Dr. James, but the only thing I had ever really heard about MTHFR is that if you have that genetic variance, then it's actually more difficult for your body to like methylate. I think, is it the folate? So all those everything we enrich our wheat with, right?
Right. The folic acid, right?
Right.
It actually stops the process. It blocks the pathway.
Yeah. That's why it's a kicker, because you walk down those middle aisles of the grocery store and everything is enriched.
Yep. Enriched bread, enriched cereals,
Yeah.
all of that. And so if you do have, so first let me say that something like 60% of the population has at least one MTHFR variant. And so that having one variant is not the issue. You get one from each parent, right? And so if you have he says we don't use the word mutation anymore, but let's just use that to make it easier to understand, right? So if you have one mutation out of two options, then there's not much to worry about, right? Like you lose about 10% function is what they think. But if you have a double variant or a double mutation, for lack of a better word, then that can reduce its function, down to 30% or 20%. So then that's when it becomes a risk. That's when it becomes a problem. And so it's so interesting when the research on this first came out, around 2014, 2015, like I heard people say, well, I have MTHFR. Well, yeah, we all do. But we all have the MTHFR gene, right? So you need to take a step back and not be panicked at the moment, right? It's, okay, do you have the variant that puts you at higher risk for being able to detox pesticides and toxins and all of the things that we were talking about with him? So it is a conversation worth having with your physician.
Yeah. It's interesting for you guys to have put it in that kind of space of thinking of it as giving a parent or yourself the ability to have agency, because that's the problem, right? Like when when you've been dealing with autoimmune issues for your whole life, like you don't know what it would be like to not have dysfunction, right? You don't know what that looks like. So it is just a part of who you are. So, if you think about the agency piece of it, like if I have this piece of knowledge, then I can make a different choice. And then over time, it might impact me for the better, right? Versus it just being this overwhelming, like, you can eat nothing but grass. But no, don't eat grass. But,
Yeah.
because we tend to want to find the easy path. And that's the problem with, I think, a lot of this health conversation is it's really overwhelming. The cooking and the buying and you know, it's a little bit of a trial and error, of what works, what you can eat and what you can't eat. There's the whole glyphosate piece and the organic piece, but is it the phytotoxins? I mean, there's a whole phytotoxin, I think, argument on the vegetable side of things, like which vegetables are better to eat. You might have somebody who really can't handle any of the cabbages or things that have like a like a high, I think that phytotoxin, that's probably the wrong word, but response where you get gassy and bloated and miserable when you eat it. But that's the nuanced part, that we're all uniquely different. And so like, we almost need to journal it out. We just need to pick one thing and think, okay, I'm going to try, just doing this for a while and see if I feel better, and then try another thing, knowing that it's beneficial in the long run. Like
Yeah.
if you're choosing to eat organic, that's beneficial in the long run, even if it doesn't help you feel better. You don't just give up on organic.
Right. Right. And he said that, right? Like
Right.
you're not necessarily going to know, right? Is
Right.
this helping?
You just know you're walking a better path,
Yeah.
and then you try something else. Because I know the supplement conversation, that gets overwhelming too. Like,
Well, and there were lots of supplement companies that jumped on that MTHFR bandwagon, right? They were like, oh, you've got this double mutation, then you need to take these supplements, right? And so then you end up getting supplemented, to death, and the cost is astronomical. And so,
right.
yeah.
And you have to be careful, because if you have sensitivities, like some of them have gluten in them and, all sorts of other wonky things, like it becomes this you get stuck in analysis paralysis
Yeah.
of all the possible options. And you have to actually live your life every day. And I think that's where moms get stuck. Honestly, unless it's life or death, like, if it wasn't that, like we were having to make like really hard decisions about my daughter's health. Like we were having to make a decision to put her on a really expensive drug that was going to shut her liver and kidneys down. That's what made me be like, okay, we're going to change everything, because we just kind of stayed on that train of, medication and, doctors, and just trying to calm it down that way. And it wasn't until we were kind of at this crossroads where we had to make a huge, from a parent perspective, the guilt of that decision. Like, I just remember sitting in my kitchen, both my husband and I in tears, trying to figure out, like, what are we going to do? I don't feel comfortable going this direction. And my husband was like, well, I don't feel comfortable going this direction. I was like, well, we got to figure, can we try it? We had to come to like a compromise of what to do. And so for those kinds of situations, it's a little bit easier. It's way harder when it's something like ADHD, unless it's extreme, unless you're really having to, you're in mental health crisis with your child, ADHD can be something that is just part of you and who you are. And, we're going to manage it with medication, and we don't necessarily think about all these other things. Same can go with other mental health diagnoses. It just depends on where they are on that spectrum, how much they're affecting your life, which is what Dr. James was saying.
Sure. But we also know that all of those diagnoses wax and wane in severity, right?
Yeah.
And just like every time we get in a car, we don't know how high the risk is that day for getting in an accident. We just know the risk is there. And so I'm just a firm believer that once we've identified the risk, then we do need to do everything that we can to, reduce the risk, to mitigate the risk, to lower the temperature on the risk. And so making half of your plate green seems like pretty no-brainer kind of choice. Because they're full of B vitamins, by the way. So that's the issue. So So when you have a double variant, you do need B vitamins and methylated folate in order to reduce some of the risks that having that variant can cause. For example, high homocysteine, right? So it gets in the middle of being able to break down homocysteine, that amino acid that can build up in the blood and damage the vessels, increase cardiovascular risk, increase blood clotting risk. And so, okay, well, there's a risk. How can I mitigate it? Oh, B vitamins can help mitigate that risk. I ought to eat food with B vitamins, right? Like those seem like choices that are low risk for big reward.
I hear you in theory. I just know someone's out there going, but it's disgusting. I just can't do it.
And then you could look at supplements.
Right, exactly.
Right? You could take B vitamins.
I can't handle the texture of spinach cooked. Blah.
Well, can you handle other green vegetables?
I can. I'm speaking for others.
Yeah. Can you do spinach salad? I like spinach salad.
Yes. I like most greens. Some of them don't like me, which is why I said, it really depends. There are things I don't choose because I don't feel good when I eat them.
Yeah.
So I have to not eat them.
Yeah.
So you have to kind of, like I said, journal your way through it a little bit because yes, in theory, all of those things are good and you should try them, but also, you also have to pay attention to how it makes you feel when you eat it, At this point, my daughter and I are very much like oh, nope, that's out. We can't eat that. Because the reaction is almost immediate. We can feel it. But for some people, it's not like that. It's slower. So then you can't always correlate it either. If you don't feel any effects, my daughter can't eat corn. When she was younger, it was fine. I mean, we avoid it anyway now for other reasons. But when she was younger, it was fine. And she would get sick at night. But as it got worse and worse and worse, now she can't eat it at all. She gets immediately violently ill. Immediately. So, I think some of that stuff just changes over time. You just have to be watchful.
Yeah. All right. Well, this has been a super interesting conversation, don't you think?
Oh, I guess. I think we could have talked about that for a long time. There's so many questions.
Yeah. Well, I think we just need
I led to more questions.
We need to have Dr. James back. But we are out of time for this episode. So we're going to wrap it up. We're super excited that Dr. James joined us. And so if you want to know more about him, you can visit his website at truelifemedicine.com. That's Dr. Randy James. All right, moms, thank you so much for listening today. If you liked our show, we would love it if you would follow us on Instagram and Facebook at The Brainy Moms. You can find our website at thebrainymoms.com. If you'd rather watch us, you can go to our YouTube channel at The Brainy Moms. Look, that is all the smart stuff that we have for you today. We hope you feel a little smarter, and we're going to catch you next time.